Hello, I'm Dr. Tamsin from Turn the Corner Medical Clinic, and this video is to help you with information about your IUD. You're interested in an IUD for either contraception or managing menstrual loss, and I'm going to give you a bit of an update about how it works at Turn the Corner and what you can expect. Firstly, an IUD is an excellent choice. They're safe, they're effective, and over the longer term, they're cheap. And regardless of whether you need them for contraceptive purposes or whether you do not need them for contraception but wish to reduce your flow of your period, then they are excellent. There are two types of IUD that I use and we use here at Turn the Corner. They are the copper IUD and the progesterone IUD. The copper IUD has benefits for women who don't want or can't use any hormones at all with the IUD. The downside of the copper is that they're a little bigger, a bit more uncomfortable to put in, and they will increase your menstrual flow. That being said, they still have benefits and certainly are beneficial for a lot of women. The progesterone IUD is either the Mirena brand or the Kyleena brand. All the IUDs last for 5 years. The Kyleena has a slightly smaller profile. It's been designed particularly for women who haven't had children. It has a smaller amount of progesterone in it. However, you may find if you have the Kyleena IUD that you get some breakthrough bleeding, and it has a slightly less efficacious numbers. The Mirena IUD is probably the most popular IUD we use here at Turn the Corner. It is over 99% effective as a contraceptive, and it's very likely that over the course of 3 to 6 months you will either have no periods at all or your periods will become much lighter. It's safe for women who have a higher risk of clotting, and it's safe for women who have a higher risk of breast cancer. There are multiple reasons why you could or couldn't have the IUD, and for this reason we encourage you to come along and have a preliminary discussion with your doctor regarding the IUD benefits and risks for you. Any of the doctors at Turn the Corner can have this discussion with you. You don't need to see myself or one of the other doctors that put the IUD in. However, do make sure that you tell the reception staff prior to booking or with your online booking that you are intending to have a discussion about the IUD. So, once you come along, you'll have a preliminary discussion, you'll talk about the IUD, and you'll go home with some instructions and a script, and you'll have also gone through your consent form. One of the other things we'll need to discuss with you is whether you're up to date with your cervical screening, previously known as a pap smear, which is now 5 yearly for most women who are negative for HPV, and whether you're up to date with your STI screening, particularly chlamydia, because we don't want to put an IUD in if you have a positive chlamydia test. One of the other aspects that will be discussed is that on the day of your IUD, it's very important that you are not pregnant. So for women that are heterosexual, we encourage you to not have unprotected sex between your period and coming in for your IUD. It is safe to have the IUD put in during a period, so don't be concerned if that's actually the case. So with the IUD appointment, so on the day we need you to have taken some Nurofen and Panadol and to have booked the proper time. At the moment at Turn the Corner we are running IUD clinics en masse, so we don't scatter the IUD insertions throughout the day. This enables us to ensure that we're providing you with an extremely high quality service, and one in which you will feel safe and secure and well looked after. So these IUD insertion appointments can only be currently booked through the phone or in person. Sometimes when you have the discussion with your doctor in the preliminary appointment, it will be important for you to book it at that point in time. So on the day, arrive having eaten something, not had unprotected sex, and having had some Nurofen and Panadol, and bring with you the IUD. I would encourage you to go to the pharmacy a couple of days prior to your appointment to get the script filled, to ensure that you don't have the awkward moment where you go to the pharmacy on the day of your appointment to find that actually they have none in stock. One of the IUDs we prescribe is the Mirena, and when you go to the pharmacy, this is what you'll be given. So don't be surprised when you see an enormous box. Most of it is the actual applicator. Only a very small amount of that box is the IUD. So I'll show you inside the box. This is what the Marina looks like. And the other IUDs do look very similar. The IUD itself is that big, so the rest of it all gets thrown out. The Kyleena is very slightly smaller, but as you can see, it's marginal. It's not a huge lot smaller. What I'll talk you through now is what to expect after you arrive for your IUD appointment. So once we are sure that you're good to go and safe to go, this is the IUD bed. It will have some stirrups, so we will expect you, and unfortunately it's a very exposed experience. To lie back, you'll have your legs in the stirrups so I or one of the other doctors can actually see what we're doing, which is helpful. The bed's elevated, and then as with a cervical screening test, and after your vulva has been cleaned and you're calm and we're all good to go, the speculum is inserted into your vagina and opened quite widely. Wider than you would normally have with a pap smear, so sometimes this in itself feels a little uncomfortable. Once you're comfortable with that, anaesthetic spray is sprayed onto your cervix, and we allow the anaesthetic spray to work for 3 minutes. This does feel like possibly the longest 3 minutes of your life, but it's very, very important that we allow it to work. Because the IUD needs to sit inside your uterus. Women's uteruses, or uteri, are sitting at an angle to the vagina. So for me, or one of the other doctors, to be able to insert this IUD into the main section of your uterus, we need to get rid of this angle. Otherwise, if I was to try and insert it straight, basically it would just bang into the end of your uterus and be the side of your uterus and be pretty useless. To get rid of that angle, I need to put traction on your cervix. That involves these unpleasant, extremely sharp, piercing forceps. Essentially like a lip pierce, which is why we use the anaesthetic. So once the anaesthetic has worked, these are placed on your cervix, like that. Traction is put on your cervix, and then I have to measure how deep your uterus is. This kind of measuring device, not this one, obviously a sterile one, is put through your cervix all the way out the other side until it reaches the top of your uterus. This is where there's a theoretical risk of perforation of the uterus. Now, when you're awake, as you are at Turn the Corner, I think the risk of perforation is very low. You will feel this, and it's not that great. So most women feel this touching the uterus and feel it's a bit uncomfortable, and therefore will let me know, and I know, we can feel the resistance, and also you usually say, out, to be honest. Going through the cervix is also a little uncomfortable, and for some women it's so uncomfortable or so tight that actually I can't get the measuring device through, and therefore we have to actually stop and can't put the IUD in. To be honest, the biggest risk for you on the day is that could happen. And I would say, in my experience, that happens in about 1 in 20 cases, and mostly happens in women who are older and who potentially have a slightly scarred or tighter cervix. So once I've gone in here and can then see how deep your uterus is, I know what to set the flange on this IUD device, and the IUD is inserted and released. The IUD insertion is actually the least uncomfortable part of the procedure, and the entire procedure, once we get started, only takes 5 minutes, and 3 minutes of that is taken up with us waiting for the anaesthetic to work. So fundamentally, the process, there's a lot of preparing, a lot of ensuring that you're safe and well, and there's a lot of setup, but the actual procedure itself is relatively short. After the IUD is in place, then the strings are cut to 2 centimeters, and all of the kind of equipment that we use is taken out. Where the clamps have been on your cervix, those 2 points bleed, and so I'll need to pop some light pressure with cotton on those areas until that bleeding stops. And then we remove the speculum, take your legs out of the stirrups and just allow you to, gather your thoughts, because sometimes at that point you'll get a bit of cramping you'll feel inside your uterus. The other big risk with IUDs, apart from perforation, which as I said is unlikely, and failure of insertion, which is semi-likely, is what's called cervicogenic shock. Now, for some women, having processes done to the cervix causes them to essentially faint. It's a bit more complicated than that, but it's essentially kind of like a faint. For this, we have to set up some medicine which is called atropine, which we have to give to you if that happens. Here at Turn the Corner, we do a lot of IUDs, and so far we haven't had to give atropine to anybody. At family planning, where they put IUDs in all year round, they have to use atropine somewhere around 10 times a year. So that gives you an idea perhaps of the rarity of this occurrence. So we do set up for this, and for all these reasons, including some of the time required and the equipment that we need to use, the IUD insertion does come with a degree of cost, which at the moment is sitting at around $296 out of pocket for you on the day. This does not include the discussion that you have prior to the IUD going in. That's a separate consult. I also really would like you to come back after 6 weeks so I can have a single appointment with you, pop a speculum in, make sure that IUD is still sited correctly and that the strings are at the same length that they should have been when I cut them. Ongoing, it's important that you, after the IUD is inserted, rest and relax, and I find chocolate is essential. Don't shower, well actually sorry, that's not true. Don't bath, you can shower, but you're not allowed to have anything in your vagina for at least 3 days, so that includes tampons, having sex and bathing or swimming. After those 3 days you can actually bathe, but I prefer that you don't resume sexual intercourse until 7 days has passed. The IUD itself, I also think it's best to wait for it to have 2 weeks for it to be effective as a contraceptive agent. And then moving forward, every couple of months it's worth you popping a finger into your vagina and making sure you can actually feel the strings. If you feel that you can't feel the strings, or if you can feel the device, then it's important that you come back and call me or call the clinic straight away, and also use other forms of contraception until we're sure that the IUD has been correctly placed. When I give you your afterwards instructions, I usually include my private number, and this is to enable you to have ease of access to me should you have some concerns around bleeding or cramping that seem to be going on beyond what you think is acceptable. So thank you for listening to the IUD presentation. I do think it's an extremely effective method for contraception and for minimising periods. And if you want to find out some more, please feel free to book with any of our doctors to talk about it as an option for you.